Hi everyone, this is Dr. Lin. I'm here at Glow Laser Beauty Center. I just want to make a video today to share with everybody how at Glow Laser and Beauty Center we do facial rejuvenation. Over the last few weeks you may have seen a lot of videos that Liz and Aaron did on facial rejuvenation with different tools. One is you've seen them do lasers, the other one you've seen them do plexor showers. And then we also talk about Dysport, Botox, neuromodulator, dermal fillers, etc., etc. So I thought I'll take this opportunity to share with you the approach here at Glow Laser Beauty Center, how we do things. To really get a full facial rejuvenation, we really need to understand the aging process. So when we talk about the face, there are three things that usually comes up 99% of the time. It's called the 3Ds. Most people as we age, we lose 1% of the fat pad as we age on a monthly annual basis, and by the time you turn into 4th, 5th, 6th decade of your life, most people start having some volume loss in the mid-face. And actually, when you look from the top to bottom, the volume loss area usually that shows the aging process is sort of area up here, so the brow starts to turn down, especially in women, and then the temporal hollowing, there'd be hollowing around this area, and then finally you come to the mid-face. Usually you start losing mid-face volume, so your tear trough area starts to show, you start to lose some volume there, and finally women really need to have this zygomatic arch to have that youthful look, and they usually lose that. And for men, the square face, that masculine face, usually starts to deflate and everything starts to get pulled down. So that brings up to the second D, which is the descent. So when you lose volume in your face, you have excess skin that starts to hang over, and gravity always wins. It starts pulling down. And besides the gravity pulling everything down, in our facial muscles, we have a lot of muscles. There are muscles that help us raise stuff, and there's muscles that help us depresses certain facial expressions. So, for example, with the descent and gravity, most people get these Marionette lines as they age. The reason for that is because there's gravity pulling down the skin with the volume loss, and secondly, you have a depressor muscle right here at the corner of your mouth that comes down here. This depresses sort of the corner of our mouth to come down, so that when we activate that, and with the excess skin and also some deterioration of the skin, you start getting this line. So there's a variety of ways that we manage that, and I'll go into how we treat some of these problems. And finally, the last D is what we call deterioration of the skin, and is in two folds. One is the actual tissue of the skin starts to get thin, and the elasticity of our skin, you start to lose that elasticity. So collagen deficiency and elasticity deficiency is one of the aging signs of the tissue. And finally, you have the environmental things that can cause discoloration, so pigmentation because of the sun, and or loss of subcutaneous fat, and then these vascular veins starts to show and you get redness and the purple and stuff. So when you talk about complete facial rejuvenation, the approach that we always have is to address those 3Ds. And how we address those 3Ds, really we deploy all the tools that we have, but most of it we can accomplish it with no downtime, very minimal invasive type of injectable things. And we'll talk about what injections we do to address all these 3Ds. So when we talk about injectable techniques, what here at Glow Laser Beauty Center, we have adopted Dr. Stephen Mulholland's method of facial rejuvenation. We talk about various type of injections. So when we inject neurotoxins or neuromodulators, these are Dysport or Botox, that accomplishes, relaxing of the muscle, and we can help reshape the face by attacking certain muscles so that we can relax those muscles, and you can actually naturally help your face lift up. So for example, this corner of mouth muscle that I just talked about, if we inject 5 units on each side, it relaxes this depressor muscle, so that naturally the elevator muscle takes over and we can neutralize that's this downturning corner of the mouth, as an example. Our 11 lines, these are depressor muscles that depresses the eyebrow, draws the eyebrow in. So if we relax these muscles, it can actually help relax this area. And then for women who likes the arch of the eyebrow, we can actually help reshape the eyebrow and let it lift. And for men, we like to keep it even to be masculine and stuff. So these are nuanced techniques, advanced techniques that we deploy here at Glow Laser Beauty Center. And not every Botox or Dysport injections or injector are the same. And so many times there's a lot of discussion about, oh, is Botox better than Dysport, Dysport better than Botox? And in our practice, we find that they're equally effective. It's really technique and how we train our staff, and how I train my staff, and how I do the injections that really makes a big difference on shaping the face. Second injection that we talk about oftentimes is what we call volumizer injectables, such as dermal fillers. So the Juvederm, Restylane, the Versa, we have it all here at Glow Laser Beauty Center. And these are 5-hyaluronic acid that we inject into areas to help buttress those sagging and deflating tissue. So the areas that we typically buttress up would be the supraorbital area, the mid-face zygomatic area, the tear trough area, infraorbital area, and then of course our perioral area, our jowls, and the angle of our jaw. And we try to craft that so that for women we have this nice triangle with a really nice line for the angle of the jaw. And then for men, we try to square this up so we make it more masculine, as an example. And in addition to the fillers, we usually like to use regenerative medicine techniques such as PRP injections, as well as nanofat injections. And we can talk about that, and we'll make a separate video on that. And finally, the last D, we have the most comprehensive energy devices to help attack the collagen deficiency, elasticity, as well as the skin and color. So we have a Cyton laser that can do total resurfacing of the face with minimal downtime with our halo laser, and it's one of the top 3 laser procedures performed in the United States, and we're the only one in Erie that has the halo laser. We're the most comprehensive in-mode radio frequency center. We're the premier center for in-mode because we have all of their radio frequency devices, such as the Morpheus 8, the AccuTite, BodyTite, FaceTite, and these technologies change the way some of the patients approach surgical procedures, because these procedure fills in the gap patient. You might not be quite ready for a complete surgical lift, but you're sort of too far gone for us to just do the injectables. So we can actually do the FaceTite, which is FaceTite, BodyTite, AccuTite, which is a gap procedure that we can really produce tremendous results with really minimal downtime. So, and we'll make a separate video on those things as well. But I just want to share with all of you the approach at Glow Laser Beauty Center and the difference of how we do things and why we get the results that we get at a very cost-effective manner to rejuvenate a complete face. So we'll be making more videos on each of these devices as the weeks goes on. So if you have any comments or any questions, leave it below and we can answer them at Facebook or Instagram. And I hope to see you soon in our office to do a consultation. See you then.